program coming up for you. Kristin Huisenga from the Gateway Impact Coalition Substance Abuse Council. Got a long title, I guess. Kristin will be talking about particular issues of that group. I guess they'll reacquaint us because, things change over time. Things move around, and organizations change. I guess give us the latest update when we talk about these organizations dealing with local substance abuse issues. What's going on, and what are the combinations that are in place today?
Sure.
Just so people know the organizations.
Yes. Well, to start out, the Clinton Substance Abuse Council is the actual nonprofit, and we've been around for 32 years. So actually, just kind of looking into the coalition's history, and started back in 1989. Some parents were concerned about their kids drinking underage. So it's crazy, we're still 32 years later, we still have those same concerns, especially with prom coming up and everything, and we'll get into that in a little bit. But since that time, there's been, I would say, maybe breakout groups, or we call them coalitions, but kind of breakoffs of it. And we have the Gateway Impact Coalition, which serves the geographic area of Clinton. And then the Comanche DeWitt Coalition, which is pretty obvious where it serves. So they're a little bit more specific to those communities so that they can meet the individual needs in the communities. Then we have some other stuff that we're also have our hands in, but without confusing you too much, I'll leave it there, and people could check out our website if they want to know more.
In doing this, I guess, how long you've been doing this for a long time as well? What have you learned over the years?
Yeah, I've been doing it for over 15 years. I started under the Meth Reduction Project, so really the anhydrous tank locks, if you remember all of that stuff, the meth hotline. And I think over the years, the thing that I learned is how important prevention is. It's much more exhaustive to chase the problem down once it started. If we can back up and prevent it, I think it's just so much more meaningful and impacts so many people. And to prevent that pain and those hardships and those issues that come along with substance use, it's a lot easier to prevent, and I think is the best way to go. So prevention really is a priority.
We were talking before the show that you had a number of topics. We'll start there. What are the hottest topics that you want to mention that we should be aware of?
Yeah, well, the first was, we're getting into May. Summertime, we usually see an increase of underage drinking reports, or just kids getting together, gatherings. We'll have graduation and prom and those sort of things. We typically get a number of calls from concerned parents, right? That they hear that other parents are hosting parties of underage drinking, and they're not okay with that. So some parents say, well, it's up to me if I get to choose to have my kid drink or not, and that is true. You are able to make that decision for your kid, but you don't get to make that decision for other people's kids. So we do want to keep them safe. Oftentimes we also hear that parents will say, well, I took their keys. They were safe, right? They weren't going anywhere and they weren't driving. But other things happen in these situations besides just people drinking and driving. Sexual assaults, fights, just other risky behavior that happens, that we want to make sure that we're just protecting kids. And our purpose is using science, right? Is we want parents and community members to know that a kid's brain's still developing. So anything that we introduce into that kid's brain before age 25 or whatever their brain is done growing can change that brain, and we want to prevent that. 9 out of 10 people that have a substance use issue started before the age of 18. So our goal is to prevent and delay having people use any sort of substance.
What's when you talk to these teens, is that the primary concern in society today is the teenagers, the younger, the underage folks?
Well, that's our primary concern. Yes, we think prevention and starting before it happens. Definitely we do some different intervention things, but prevention, we believe it should be the priority. Yeah. And I think our community is getting on board with that as well. More and more support we're seeing through the years, understanding how important it is to prevent. I'm sure you're familiar with the different efforts around trauma and ACEs in the community. So basically there's all this body of science coming out that says when bad things happen to kids or trauma happens to kids, it impacts them and can change the rest of their life. So in my position, I've had the opportunity to talk to a number of people that have been involved in substance use, maybe now in recovery, maybe not. And usually they can point back to some sort of trigger, something that happened in their childhood that maybe they're trying to deal with or cope with. And so also preventing that trauma, working with kids and parents and just building those strong family connections. Our role is to work within the community to change that context, right? To try, what laws and norms do we have in our community that are allowing these things to happen, and how can we address them? And so that's one of the big efforts that we focus on.
Are there things that can be done? Can parents do some things?
Absolutely, parents can do. Parents are the most powerful tool. Parents, even just talking to your kid, forming that warm relationships where kids feel comfortable, maybe asking questions or coming to mom and saying, so-and-so is doing this, I don't know what to do or how to handle the situation. Just talking to your kids alone could reduce it by 50%, use substance use. So we want those, that's first and foremost. If you've seen us out, well, I guess with COVID, you haven't seen us out for a while with our Hidden in Plain Sight trailer, but we have this bedroom that we take around to different community events. Hopefully we'll be back out there this summer. And parents can go through and see just different drug trends. What do things look like? It doesn't look like maybe what you remember when you were a teenager. Even 5 years ago, things have changed. An example would be like 420 is kind of like the International Marijuana or Pot Smoking Day. That's kind of been a terminology that's been around for quite some time. Now the lingo is 710. And that has to do with the type of marijuana that's now out there. It's more concentrate in oil, and oil upside down is 710. So parents may see these things and think, what are you talking about? Like, I don't get it, or I don't even understand. So one of the things we're trying to do is educate them, and so they can have those conversations with their kids and just all be on the same page and develop a plan as a community or as a family. One of the things that we ask kids actually, is it against your values to use alcohol and drugs as a teen? And if a kid say it's not against their values, that's really hard, right? Because values are something that is hard to teach later in life. That's something you kind of grow up with. So we're working really hard to make sure that parents have the tools that they need, the resources. You could call our office. We'll do a presentation for you. We've been doing some Zoom presentations with some of the employers here in town, because they said, well, we want our employees to have this information. So we've been doing these Zoom calls to kind of raise the awareness and share some information with them as well.
Here's things that are kind of later on the list, but since you brought them up, we'll jump up the list.
Sure.
Maybe it's on your list there somewhere too.
Okay.
You mentioned particularly a couple things you mentioned. Jump about the relationship with the parent. What if it's another family member, whether it's a grandparent or somebody else, so maybe that child has a relationship with, that they're more willing to talk about these things than mom and dad.
Yeah.
Is that okay? Can they play that same role? Because those can happen in certain situations. You're
absolutely right. And we call those protective factors. And the more positive, competent people that we can have around a youth, the better. I don't think you could ever have too many, right? So that's why there's programs like mentoring and different opportunities for people to get involved with youth group and just different things. So you have access a lot of times to these adult mentors who are just providing good examples that they're forming these relationships with the kids. So you do have somebody to go and talk to. Yeah, it's not always mom and dad. I have teenagers, so I definitely understand that that's not always the case, but you want those positive supporting people around it. On the other side of that, if the people surrounding your kids are negative influences, they could have negative impact on your kids' belief systems, values, all those different things as well.
Too, you mentioned marijuana, and it's probably on your list somewhere. What about that situation when in Iowa it's not for recreational use? Mm-hmm. Maybe we say yet, who knows?
Right.
Illinois it is. I mean, across the river.
Right.
Not as teens, you got different things like that going on. It is available for medicinal purposes in Iowa. Those open some doors that raise some concerns for the Substance Abuse Council.
Yeah.
We don't, not always alcohol.
Absolutely. That does raise a lot of concerns for us. But I think the important thing for everybody to keep in mind is in almost all the states, you have to be an adult to purchase and to consume those. Nowhere has anyone said it's okay for youth or youth should smoke. There's some very rare instance with CBD oil for some conditions, but it's not something that youth should engage in. So they do see, though, the states are legalizing it and thinking maybe it's less harmful or it's safe or whatever kind of mentality that they may have around it. And so we're working to provide factual information to them. So a lot of the information that is new and it's coming out, I was just in a presentation earlier this week, and they talked about the potency even of marijuana. So when people typically think of marijuana, they probably think of the plant, right? The organic material that's grown, ditchweed, maybe, God's plant, whatever you want to call it, that's been around forever. And it has been. But in the last 50 years, that potency has changed from about 1% THC to, I think the most recent data coming out of Colorado is averaging 60% THC. We're talking two completely different substances. And this is one of the things we work a lot with parents, because they don't understand this. They think, well, Woodstock, or that's just, whatever. Well, it's so different now. And what does that mean? We don't actually even know what it means. The highest THC content that's ever been studied by medical researchers is 16% THC. So we know what 16% THC does, and it increases some psychosis and some mental health issues, and there's just suicidal behavior. That we know at 16% THC. But if we're not talking 60% THC, this is a game changer yet again. Everything is moving so fast, it's hard for us to keep on top of it. Last year, the Surgeon General came out and said there's no safe amount of marijuana use for kids. And so that's what we want parents to send that clear message to their kids. It's not okay with us for you to be using this substance. Other just cool information I always share with my own kids is they now can see from medical research that if a kid uses marijuana around 12, 13 years old, it changes their brain in MRI scans forever. It changes the actual matter in their brain. They can see if a kid ever used. We don't know what that means, but we can see that their brain has changed. So anything that's changing your brain is definitely a concern, I would say, of a prevention agency, because we want kids to grow up healthy and happy and their brain working to the full potential that they have.
Okay, I know you brought a list. What's next?
What's next on my list? Well, the other thing I wanted to mention is you may have seen that we received a summer youth internship grant. So I just wanted to share a little bit about that. Some people said, well, why you guys? That's kind of...
Why it's not in your, not as substance abuse related?
Yes, well...
Or is it?
Well, it is. The target for this program is at-risk youth, okay? So they want to be able to provide youth opportunities for employment, to get a job, to be gainfully employed in the workforce in the future. Well, that is in our wheelhouse, because we want all kids to succeed. And we know if someone's underemployed or unable to get a job, that could lead them to risky behavior. So the more opportunities that we can provide youth, the better. And so this opportunity came up, and it's great for youth to provide these opportunities. It's great for employers, especially a lot of us nonprofits that are small with 1 or 2 employees. We have some needs that we just don't have the budget for. And so having some youth come in and work would be an awesome opportunity for us. And it's great for the community. The more opportunities and the more, Clinton's a cool community. We want our kids to come back here, right? We want them to go to college and come back here to Clinton and use all their skills here. There's so many nonprofits that are constantly hiring. So we thought, well, what if we could kind of wrap all of these things together? And we were able to do it, put it into an application. There were 8 employers that will be partners with us that will hire an intern to come in, and they'll provide opportunities for 13 interns this summer. So it'll be about 6 weeks is the minimum, but some of them are a little bit longer. They can be up to 10 or 12 weeks. And some of the internships are part-time, maybe 10 hours a week, but some of them are full-time. And there's office jobs, there's outside landscaping jobs. So we thought it was really just this cool opportunity to give kids kind of just this experience of what potential jobs could be in the future. And so our role is bringing people together and collaborating. So we're the project manager on this, but really it's about the partners in the community that are willing to host these interns.
Is this can play a role in, you mentioned the prevention side of it is maybe giving, you mentioned at-risk youth, an opportunity to learn what's out there. And that may then play into your prevention of substance abuses?
We hope, and we think it's all connected. It really is. Everything that we can do, either with an individual or with the community that can prevent substance abuse or use, is good for our whole community. So yeah, we're really excited about it. Starting here on May 1st, some of the partners that are going to be involved with that are the United Way, the Community Center, the YWCA, the Downtown Alliance, the City of Clinton, the Comanche DeWitt Coalition, the Gateway Impact Coalition, and the Lumber Kings. So you can see that there's a lot of different opportunities for these kiddos to get involved.
What's next?
Okay. Well, last weekend was the DEA Take Back Day. We didn't participate this time. The communities participated on and off for years, but we thought maybe some people still had some medicine laying around, and they thought, well, what am I going to do with this? I think it's always good to remind people that we have places that will take medication back all the time. This actually recently came up. I was talking to a provider, and they had been working with somebody that is addicted to opiate medication. So opiate medication would be pain medication, right? And in going through their history, they said, well, how did you get started? You know, like what was kind of the trigger? I'm sure as part of their history questions. And this particular person shared that their grandfather had passed away, and this was an adult, okay, young adult, but it was left to them to clean out the house after the person had passed away. And in this house was hundreds of bottles of prescription medication, okay? And so this person now had access to all this medication, which there's a couple of issues that we could address there, but let's just say for the purpose of this story, lots of medication. And the person started taking some of the medication and actually became addicted and hooked. A number of years later, now they're in our program and we're trying to get them help. So this happened right here in our own community. So people say, well, that doesn't happen here. Well, it sure does. I mean, and that's kind of an extreme example, but we've heard other examples of kids getting access to some of this medication in people's homes. So what we want you to do is, if you have medicine in your home, because this can be just as easily abused. Actually, for middle schoolers, this is the number one thing that they report abusing is medication. Okay, so you want to lock that up in your house. So if you have a gun cabinet, I recommend that's a great place to put it because it's a serious thing that you should keep safe in your house. Otherwise, it should be put somewhere safe, not the medicine cabinet in the bathroom that everybody visits, right, when they go, because now they have this private access to your stash. And if kids have a prescription for medication, we want parents to be monitoring and controlling that, right? So not, Johnny, here's your prescription, take one every day, making sure that they are, because we do know kids share some of these medications, especially the ADHD medication or whatever, around test time and finals time is something that's popular. Keep that medicine safe. But when you don't need it anymore, we really encourage you to get rid of that medication. So there's different ways that you can do it, but here in our community, we actually have a bunch of options. In Comanche and DeWitt, the police departments still take it. We used to do that in Clinton, but now we've had some businesses step up that take it and kind of take that burden off of public service. So here in Clinton, you could go to Hy-Vee, Wagner Pharmacy, or Walgreens North. So they just have drop boxes. Bring in your pill bottle, whatever you have, you just drop it off, no questions asked. You don't have to take off the label, anything like that. Also, we have Scott Drug out in DeWitt that takes the medication as a business. And then I added Fulton City Hall over in Illinois because we have so many people coming back and forth over the bridge. So normal business hours, those are open, but people could call our office if they have questions or want to know more about it. Or if they have a bunch of medication and they don't have any way to get one of these, I encourage you to reach out and contact our office and we can see what we can work out.
Hey, for a number of years, the agency did the drive-by or drop-off, things like that. Kind of got out of that because you have enough standard fixed locations now to make it easy. Don't have to wait for a particular day. Whenever you have some, whenever you clean things up or maybe your prescription changes, you can get rid of the old anytime now and not wait for April or May to clean out your medicine cabinet.
Yeah, I think we might still have it from time to time, but not as regularly, right? Because we do have these awesome opportunities any day.
Has it paid off in collecting things?
Well, I mean, we've taken over 10,000 pounds of medication off the streets. So I don't know how to pay, how to say it's paid off. That value of that, unfortunately, is very high, and that's a lot of medication that was wasted. But that was not in the hands of somebody it shouldn't be in.
One thing they promote too, we didn't even mention, is it also is good for groundwater contamination as well, or into the river or wherever else. If you flush it down the toilet or anything like that, or just throw it away into the garbage, saves some contamination there. We didn't even talk about that side of the environmental side of it, but that's always, when they promote that, they always mention the environmental side as well. So that's a good impact on the environment.
You're right. That and accidental. So we've only talked about intentional, right? But I mean, people can, pets can accidentally get into this stuff too. So it's serious stuff, and we should keep it protected.
Yeah, pets get medication. You can use those drop boxes for that too. So
that's right.
As your pets get medication a lot. So
just no needles.
No needles.
You know, we don't want people to get poked when they empty these bags. So, yep, no needles.
Okay. What's next?
All right, next up on my list, I'm sorry I keep coughing here, is that we actually, okay, which way do I want to go? We've been partnering with the Community Health Needs Assessment. So Mercy's been leading that up, and I'm not sure if the listeners are aware that actually substance abuse and mental health were the top two priorities, along with access to care for our Clinton County. So we've been partnering with them and offering different things. I know that you're familiar with the MAC clinic and the opiate grant that the city of Clinton got. That's still going. They actually were awarded another grant after that, so this program will continue even longer. I'm so sorry. I got a tickle in my throat here. And one of the things as part of that is outreach. Is trying to make those connections with people that have, started using or in the throes of addiction, and try to get them connected to resources. So that's something we work really hard on.
And that grant you've had that for, started a couple years ago, to maybe a little more intensive program for some
Yes.
treatment of substance abuse. Do you have people who willingly come to that and seek treatment, or do you have to go out and find them?
Both. I do. Oh, thanks. I do know that we have both types of it. Actually, more people, it's voluntary. So you could call and just, Laura, I know up at the MAC clinic, it's a lot of questions from family members or concerned people, and they want to know how this is going to happen, how this is going to work. And talk about relationships. The people that are part of this program are just amazing, and they really care about these individuals and want to help and understand addiction and what that looks like, right? So constantly trying to figure out how we can best reach these people and best serve these people. So the program with the MAC clinic actually is the person would get some sort of counseling, some treatment. So we're addressing the issues that maybe cause them to start using in the first place, maybe some of this trauma that's there, and just figuring out how we can best serve them. They also receive medication as part of this program. The medication can help with their brain, right? Because their brain's kind of, well, I'm not a doctor, right? So I can't explain it in the medical terms, but it's not where it should be. Their brain needs to heal, and the medication can help their brain heal so that they can start to think straight and not craving the drug and kind of doing all the things that go along with that behavior. They have over 20 people enrolled in the program, and I know there's other MAP programs, medication assisted treatment, here in the community as well that are busy. So it doesn't matter what program you're involved with. If you want help, we want to be able to provide the help to you.
Doing this again, Sarge, you had to have a basis and understanding that those cases were out there.
Yeah.
As this comes through and you get people who seek that or calls, is it a surprise how many or how few, or is it does you have a pretty good handle on we're going to get 10 calls and we got 10, or you expected 10 and you got 20?
Well, we wrote in the grant that we'd get 10, and within 2 months we had 25. So the number was faster than we expected to get that number, but I still only think we're scratching the surface. And right, our program is only specific to opiates. People could have a polysubstance use, drug use thing that they are involved with, which means that they would use more than one substance, right? A lot of people do. But we're not even scratching the surface, I don't think, with some of the other substances here in our community. We're really trying to figure out creative, innovative ways to address methamphetamine use, for example, those types of things. But from our role as a prevention coalition, we know if we can prevent kids from using alcohol, pills, marijuana, those things early on, tobacco, nicotine, those things, they're less likely to use methamphetamine and these harder drugs later on in life. So really, that's why prevention is so important, because it's a lot harder to try to figure out how to help somebody that's in the throes of methamphetamine addiction than it is to prevent a kid from taking that first drink or smoking marijuana for the first time or having that edible.
What's next?
Okay, what's next here? Well, I just kind of wanted to give the shout out that because we've been doing all this prevention stuff, we have awesome community partners, because when we say coalition, that's not me. I'm staff and I just do what they tell me to do, right? But this is a lot of people working together for these issues. So one of the things when we started talking about prevention and whose job is it to teach morals, is it the community's job, is it the school's job, is it the parents' job? We have a number of community partners that stepped up and said, what if it's all of our jobs? what if we all do what we can do to prevent these things? And one of those awesome partners has been the school district, right? Because they kind of have the captive audience of the kids, and they've implemented some programs with the school as well to prioritize prevention. And so we're really excited to get the results of some of those programs, and hopefully in the future I can share some of those. But other things in the community, what policies, practices, things are happening that maybe we could tighten up or do a better job of preventing. We want to send a clear message to our kids in our community that youth drug use is not okay. Youth alcohol use is not okay. We want you to be happy and healthy and safe.
Kristin, if somebody wants to do something, this is maybe they, and again, maybe people's knowledge, understanding, and interest changes. Their kids become teenagers.
Yes.
As you mentioned, you have some teens now.
Yeah.
What can they do? Maybe they're just now aware of this situation. They want to do something. Maybe they've got time. Maybe they're recently retired and they've got time to commit to a cause, and this is something that interests them. What can those people do?
Well, we would love to hear any idea that they have, but what they can do is they can start by helping us reach out. We're hoping to get back doing community events, so if you like to volunteer in person, that's awesome. We'll hopefully be at some of the maybe Music on the Avenue or different events that will be around town. What about hosting a small group of your friends to even kind of learn about some of these issues? Maybe some people have skills about doing things online that could help get the information out. Some people want to donate and give to the organization so they can support these causes. Most of our money comes in the form of grants, but that's never able to cover everything we want to do. So we're participating in Great Give Day, which is just in 13 days. I know there's a bunch of people here in town that are doing that. Yeah. So there's lots of ways that they can get involved, but I would encourage them to call, because brainstorming together, we don't like just to say, you go do that. What do you want to do, and how can we make that happen here in our community? Because there's a place for everything.
Well, get done, Kristin. I guess we kind of wrap things up. What final comments you want to make? What topics didn't we cover? Here's your chance.
Oh man, we did a good job. I think we got through a really great stuff, a lot of good stuff today. Just encourage you to do what you can do to prevent, to make those connections in your own life and with the kids around you to prevent youth substance abuse. And we would love to have you a part of our effort. So if something I said today is something that you'd like to learn more about or get involved, don't hesitate to call our office, 241-4371, or you could look up Gateway Impact Coalition on either Facebook, Instagram, Twitter, or just the World Wide Web. So,
right.
Yeah.
I'd like to thank Kristin Huisenga for coming in today. Thank you.